Thanks for returning for part two of why I think capitalism can lower healthcare costs and literally save and improve our current healthcare system. I start with a philosophical point. Sum it up in these two words: personal responsibility. Listen, I am so frustrated when I debate people about healthcare and listen to them tell me why other people should pay for their healthcare. Could we not agree that a great starting point, a goal, would be that we could make enough money or have enough money to literally pay for our own health care, that we could make our own decisions as to what health care we purchased? Can you imagine being in charge like that? And I know healthcare costs are ridiculously high. I know that. This would be the starting point that would begin a revolution in healthcare if Americans really believe this. The second point is transparency. Just knowing what you're paying for. I laugh at how people are so offended and just get mad when they go to a car lot and the price of the car is not available to them. Man, they get so upset, but yet they will pay zillions of times more for health care and never question or see anything. Can't even make out what the bill means, and we don't even care. I was in Canada several years ago. I go often, and I had an accident, and I had to go to a rural Canadian single-payer national healthcare little hospital. And when I walked into the emergency room, it's like, oh no. It was packed. Not one seat was available. But then I noticed over to the side, a door, and above it said U.S. citizens. And so I went there. And a lady, a receptionist or a nurse, she literally handed me a menu of everything that little hospital had to offer. The doctors available, nurses and their fees, what prescriptions they had, services, x-rays, those sort of things. And it had a price with every single one. It was the most refreshing experience I've ever had in my history of healthcare experiences. It was incredible. And the prices were so cheap. I asked her, I said, how can this be? And she said, well, we're making our money. We have our costs in there and then profits above that. But here's the deal for Americans. You have to pay us up front for your services. And then we'll give you a receipt. You can go to your insurance companies back in the States, but you've got to pay us up front. I was so happy. Listen, why can't we move to a system like that here? And then lastly, competition. Furious competition. Nothing will slay the beast of healthcare costs like furious competition. Take an MRI. I Googled, first page, what an MRI costs. It ranged from $400 to $13,000. I kid you not. Can you imagine going into a grocery store and either paying $2 for a gallon of milk or $50? Listen, where there's competition, the company charging $50 for a gallon of milk is out of business in a week. A week. Competition is key to lowering costs. Hey, I just want you to talk honestly with your friends and family about healthcare. And could we all agree to get the government out of it?